Chapter 7. Nursing Grades. Nurses working in a hospital have the following grades: a student nurse, a nurse who is still in training; a staff nurse, a nurse who has completed the training course; charge nurse, a nurse, a more experienced nurse who is in charge of or responsible for a ward or department; nurse manager, a nurse who is in charge of several wards. Dr. James is talking to Sister Watkins. Support workers. The clinical support workers who has done a short course and obtained basic qualifications, and the nursing auxiliary who is usually unqualified both assist nursing staff. There may also be ward checks, wards whose duties include making sure patients' notes and information are up to date and answering the telephone. And specialization. Like doctors, nurse can specialize. A midwife wife has specialized from the beginning by doing a course in midwifery, the management of pregnancy and childbirth. District nurses visit patients in their homes. Health visitors also work in the community giving advice of the promotion of health and the prevention of illness. The nurse role. The nurse role has changed considerably in recent years. In addition to general patient care, checking temperatures, pulse rates, and blood pressures, changing dressings, giving injections, and removing sutures, nurses now do some of the things previously reserved for doctors, such as prescribing drugs and ordering laboratory tests. More responsibility for nurse is planned as the following article demonstrates. Nurses carry out surgery in an effort to cut patient waiting lists. Nurses in Scotland trained to perform minor surgery have entered the operating theatre for the first time in an effort to cut patient waiting times. 5 nurses who have passed a new course at Glasgow Caledonian University are now qualified to carry on such procedure as the removal of small lesions, benign nodes and cysts. The verbs perform and carry out are used with all types of procedures. They are often used in passive form. Perform or carry out an examination, an operation, a procedure, an experiment, a test, a biopsy. The procedure was performed by a nurse. The procedure was carried out by a nurse. Exercise. Complete the sentence. Look at A, B, and C opposite to help you. Someone who specializes in delivering baby is a 2. Someone who is qualified to assist nurses is a 3. Someone who is not qualified but is able to assist nurses is a 4. A nurse who has qualified is a nurse. A nurse who specializes in health promotion is a 6. A nurse who looks after a ward is a nurse. A nurse who works in the community is a nurse. Someone who answers the ward telephone is a. Make word combinations using a word or phrase from each box. Look at the opposite to help you. Carry out, change, check, give, remove. Sutures, a procedure, an injection, addressing the temperature. Complete the sentence with correct grammatical form. An isotope brain scan is painless and easy. Biopsy of the pancreas, blank space, last March. If the patient's condition deteriorates, a laparotomy should. If a diagnosis of meningitis is suspected, a lumbar puncture must. Last year, we, blank space, a randomized double-blind group study Complete the sentence with the correct grammatical form of carry out. I now intend a larger study. Unfortunately, few properly controlled trials, blank space, so far. A number of studies, blank space, recently to look at these questions. A number arrived hemocolit- a right hemocolectomy, blank space, and the patient made a full recovery. This procedure can blank space in the emergency department.